How does BCG vaccination affect TB test results? Imagine getting a skin test for tuberculosis and wondering if a positive result means you have the disease or if it's just the vaccine talking. The Bacillus-Calmette-Guerin vaccine, or BCG, is used worldwide to protect against tuberculosis, but it can make interpreting test results tricky. When you get a tuberculin skin test, also called a Mantoux test, it involves injecting a small amount of purified protein derivative into your skin. If your immune system reacts with swelling and induration, it suggests exposure to TB bacteria. But here's the catch. If you've had the BCG vaccine, your immune system might react even if you don't have an active or latent TB infection. That's because the vaccine contains a weakened strain of Mycobacterium bovis, which can sensitize your immune system to react to the proteins used in the test. This means that a positive skin test in someone vaccinated with BCG might not necessarily mean they have TB. Studies show that the reaction can last for many years. Some people vaccinated decades ago still show positive reactions on the skin test. The size of the induration, or swelling, is important for interpretation. Smaller reactions, like under 10 millimeters, are more likely due to the vaccine rather than an infection. Larger reactions, such as 15 millimeters or more, are more suspicious for actual TB infection, but there's no absolute cutoff that guarantees this. The size alone isn't enough to make a diagnosis. Repeated skin tests can also cause a booster effect, where an initial negative test becomes positive later because the immune system remembers the vaccine or latent infection. This can make it even harder to tell if someone truly has TB or just a vaccine response. To improve accuracy, health professionals consider individual risk factors. If someone has been exposed to TB or lives in an area with high TB rates, a positive skin test is more concerning. In these cases, an induration of 10 millimeters or more might prompt further testing. Because of the limitations of the skin test in BCG-vaccinated people, many countries now prefer TB blood tests, called interferon gamma releases assays. These tests measure immune responses to TB-specific antigens that are not present in the BCG vaccine, so they are less likely to give false positives. It's also worth noting that some countries administer multiple doses of BCG, which can increase both the likelihood and duration of positive skin test reactions. This makes interpretation even more complex in those populations. Overall, BCG vaccination often causes a positive tuberculin skin test that can persist for many years, but it doesn't necessarily mean you have TB. That's why healthcare providers look at the size of the reaction, your risk factors, and sometimes use blood tests to get a clearer picture. If you're ever unsure about your test results, it's best to consult a healthcare professional who can interpret them in the context of your medical history and risk factors. Remember, accurate diagnosis is key to proper treatment and peace of mind.